Welcome to our session on costs and implementation science. I'm Andy Eisman, an assistant professor in community health in the Division of Kinesiology, Health, and Sports Studies at the Wayne State College of Education. I'm joined by my colleague, Dr. Andrew Quambeck, who's an assistant professor in the University of Wisconsin's Department of Family Medicine and Community Health, and an honorary associate of the University of Wisconsin's Department of Industrial and Systems Engineering. For declarations, Dr. Quambeck wanted to share that he has an interest in Chess Mobile Health, a web-based healthcare technology company. And Dr. Eisman has nothing to disclose. First, we will give some background of cost analysis and economic evaluation in implementation science. We will review cost analysis specifically, including costing implementation strategies, and discuss implementation costing considerations, types of cost, which to include, and why costs are central to adoption, implementation, and sustainment of evidence-based programs and practices. We'll discuss costing methods and different analytic perspectives and how these impact our cost estimates. Finally, we will discuss future directions in this rapidly evolving area of implementation science. Why study costs in implementation science? It aids in answering important questions, including, how do we know we are making the most of limited resources? How do we decide between two promising implementation strategies? How do we demonstrate to decision makers that implementation efforts are worth the cost, especially when resources are limited? Economic evaluation can help answer these questions. Public health and healthcare managers, practitioners, and economists would agree that maximizing health outcomes is an important goal. However, public health interventions, programs, and policies all have costs, and resources are limited. Determining costs and eventually return on investment helps demonstrate the value we gain from the resources we use. Cost has been identified as one of a set of key implementation outcomes. And though often overlooked by implementation researchers, cost is among the most essential and pragmatic implementation outcomes to consider for implementation decision-making and sustainment of evidence-based programs and practices. Accurate approaches to costing implementation strategies has been identified as an important area in need of further research. And cost is the language that healthcare and community decision makers speak in terms of adopting and sustaining evidence-based programs and practices. The first question frequently asked by decision makers who ultimately decide whether or not to introduce new or continue existing practices or policies in their organization is, how much will it cost to implement in our setting? There are many types of economic evaluation. The first is cost analysis, and this includes estimates of total program costs and determines who incurs these costs. This can include costs related to personnel, space, equipment, supplies, and training. Cost analysis is the first step in an economic evaluation. Economic evaluation, according to Drummond, is about determining whether an intervention is an efficient use of resources and can be defined as the comparative analysis of alternative courses of action in terms of both their costs and consequences. And this can include cost effectiveness analysis, cost benefit analysis, and budget impact analysis. Today, we will focus primarily on cost analysis and implementation science, including costing implementation strategies, and we'll touch briefly on budget impact analysis. Economic evaluation has traditionally focused exclusively on the cost of interventions or evidence-based programs themselves and have not included the resources needed to implement them. In contrast, economic evaluation and implementation science addresses explicitly these costs, including costs of implementation strategies to deploy and sustain interventions. The perspectives may be different than traditional economic evaluation, and we'll get back to this. Estimating costs aids in understanding the resources needed to scale up and spread effective practices. Cost analysis includes estimating all the resources required to implement an intervention, which may also include implementation strategies. In addition to clinical settings, it's important to think about other settings where health interventions take place, including community settings and schools, to focus on costing in context. Implementation strategies refers to the how to get the what done, or the how-to component of implementation science. They are highly specified, theory-based methods for adopting and sustaining evidence-based interventions. Implementation strategies can be single or multiple component and can vary widely in scope and intensity, and thus cost. The focus on costing and economic evaluation of implementation strategies has grown notably in the last several years, in part because of its potential impact on achieving implementation and clinical or behavioral outcomes. It may be helpful to think about costing implementation strategies using economic production theory, which holds that healthcare or community organizations must combine inputs such as labor, supplies, and technology to produce outputs or health outcomes that are subject to budget constraints. Decision makers are deploying implementation strategies to introduce new interventions, practices, or policies that will achieve a desired health outcome. One challenge of costing implementation strategies is distinguishing what costs to include. Costs related to implementing behavioral interventions can include research, development, intervention, and implementation costs. There are also costs across implementation phases, and costs can change over time. When estimating costs and benefits of deploying implementation strategies, the costs we focus on are those that would be required for organizations or practitioners to incur when delivering interventions in real-world practice. This includes all costs related to implementing evidence-based programs, including the implementation strategy, such as costs related to intervention tailoring, provider training, supplies, and labor costs for evaluation, and coaching or consultation. Which costs to include depends on the perspective. Ignoring these costs can have considerable consequences, including inefficiencies in program delivery and little likelihood of sustainment once the research is finished. Not understanding the costs and consequences of implementation decisions can lead to failure to adopt an evidence-based program. As a developing area in the field, we are working on new systematic methods to identify and track implementation costs relevant to a range of stakeholders and decision makers.
All right, so we're going to talk about a couple of different approaches to implementation strategy costing. And wanted to just mention some foundational concepts and frameworks that you're probably getting in other areas of your training, including hybrid implementation effectiveness studies and guidance on implementation strategy specification. We're then going to go through 4 different applications of methods for implementation strategy costing: time-driven activity-based costing, the cost of implementing new strategies model, the discrete strategies and clinical intervention model, and budget impact analysis. A hybrid studies here, the key reading is by Curran et al. From 2012. And really, when you're embarking on a cost analysis, it's really important to clearly specify what it is that you're implementing and how you're implementing it. We think of those in terms of the intervention as the what you're implementing, and the implementation strategy is how you're implementing it. When we have a lot of research out there on discrete implementation strategies through the ERIC model, but you want to get as clear as possible on those 2 elements when you're designing and conducting cost analyses. In terms of implementation strategy specification, key reading here by Proctor and colleagues from 2013. This paper recommends that when you're designing implementation studies, that you look at 7 dimensions of implementation strategy execution, including the actor, the action targets, temporality, dose, implementation outcomes addressed, and the theoretical justification. And for the purposes of costing, it's really important, whether you use this model or not, getting very clear on those first 5 elements: the actor, action, targets, temporality, and dose. Those are all sort of core elements that affect cost, and so they need to be accounted for in some fashion. And this model provides a very ready way of kind of breaking down implementation strategy costs into these units that are useful for costing purposes. First, we're going to go through these 4 examples as time-driven activity-based costing. A key reading is by Sadab and colleagues. TDABC is a direct measurement method, and it's really focused on the labor time associated with implementation activities. Probably not surprising that, like in a lot of areas of healthcare, labor costs really predominate when it comes to implementation strategy cost considerations. And so that's really the explicit focus. The method has very wide application in other fields. It has a pretty strong evidence base and a lot of examples. So it brings a lot of credibility in terms of implementation strategy cost assessment. The next one we'll mention is the cost of implementing new strategies model, or COINS, published in 2014 by Lisa Saldana and colleagues. But as far as we can tell, COINS was the first published approach to implementation strategy cost assessment. And one of the benefits of it is that it provides a way of organizing costs into relevant subtotals for implementation practitioners and policymakers. It maps costs related to the different phases of implementation according to the stages of implementation completion model that was developed by Chamberlain and others. And this is another one with good uptake in the field. The next one that we wanted to feature is the Discrete Strategies and Clinical Intervention Approach, DSCI. Key reading here is by Brian Garner and colleagues from 2018. They did use this approach to cost out pay for performance as an implementation strategy, and they also did a rigorous cost effectiveness analysis as part of this trial. So similar to COINS, DSCI links subtotals to implementation strategies and phases according to the exploration, preparation, implementation, and sustainment model by Ahrens and colleagues. Another feature of DSCI is that it aligns its implementation strategy with the discrete strategies that are compiled by Powell et al. In the ERIC taxonomy. It also incorporates the actor, action, target, temporality, dose specification guidance issued by Proctor et al. in 2013. So it really does integrate a number of widely used kind of models and frameworks from implementation science. Finally, we wanted to talk a little bit about budget impact analysis. There's quite a few applications here, but one key reading is by Amanda Midbow and colleagues. They published a protocol for the budget impact analysis that they're doing. Budget impact analysis is sort of the method of choice for cost economic assessment in the Veterans Administration, and it's really notable for its pragmatic orientation. The method explicitly models both the costs and the budgetary effects of implementation efforts, and it's really geared towards organizational decision makers and healthcare organizations. So a few considerations. First of all, implementation research takes place across a lot of different settings. I just mentioned that budget impact analysis is commonly used in the VA. So if you're doing research in that setting, that might be sort of the obvious choice to look at first. By contrast, the COINS method has had quite a bit of application in school-based and child welfare settings. There's also the issue of variability across settings within a study. The TD-ABC approach is notable in that it allows for site-level costing, so you can look at variation in costs that might occur across different sites within a given study, and that's important to know for sensitivity analyses and things of that nature. Data collection and reporting. One of the things that is worth noting is that these are all direct measurement approaches. And so there is a data collection burden associated with doing any of these, and it can kind of vary. I think you need to really look closely at the papers to see the extent to which the data collection is required for different approaches. And there's also the reporting aspects. A lot of these have the ability to kind of subdivide costs into categories that can be useful for different decision-making audiences. The decision-making perspective is important because if you're doing cost-effectiveness analysis, as it was done in the DSCI study, really looking at a societal perspective, that's the gold standard in economic evaluation. But it's also important to present costs that are relevant to the decision maker that you're talking to. So for budget impact analysis, for instance, it's really the decision makers and healthcare organizations might have slightly narrower concerns around decision making. Finally, just the study design. Coming back to hybrid trials here, it's probably a little bit less important to be thinking about cost if you're doing something like a type 1 hybrid. There, really the emphasis is on proving effectiveness, and you find something that's not effective, it's probably not all that important to know how much it costs. But if you're doing something more towards the other end of a type 3 hybrid, you've already determined that your intervention is effective for a type 3 hybrid. And so cost of implementing the intervention becomes a very important consideration for decision-making purposes. We'd sort of advocate for including costs at all levels, but probably more and more important as you move over towards the type 3 end of the hybrid spectrum. A couple of takeaways, as Dr. Eisman mentioned early on, some of the leading implementation evaluation frameworks, REAIM and Proctor et al.'s 2011 guidance explicitly list cost as an outcome. So to really give full treatment to those frameworks, you should be considering cost. The dissemination and implementation research and health program announcement from NIH. If you look at the review criteria, they do call for reporting on resources associated with implementation and encourages cost effectiveness analysis. These first 2 points, I think, are from a research perspective to do really high quality research. Thinking about cost is important, and it seems to be more and more the case as time goes on. The most consequential issue of all is that you're going to get this question, how much will it cost at some point or another? And when that question comes from a decision maker, you want to be ready to provide a well-informed and data-driven answer to the question.
We wanted to just come back to this issue of perspective, because the study perspective is the key determinant of which costs are deemed relevant. Drummond, in the second panel on cost effectiveness analysis in health and medicine, recommends to be as inclusive as possible to provide flexibility for analyses from different perspectives. Traditional economic evaluation includes the societal perspective, but implementation science frequently requires considering other perspectives. Consistent with the recommendations of the second panel, we propose a multi-level approach, including the policy and economic environment, organization, the provider team, including supervisors, the provider team, including frontline delivery staff, as well as program recipients. This table includes examples of different stakeholder groups, key priorities, and some examples of pre-implementation costs. For the policy and economic environment, key priorities are likely to be maximizing QALYs, or quality adjusted life years. And an example pre-implementation costs would be productivity losses or time frame to see health benefits. In contrast, the supervisory staff, key priorities may include effective allocation of staff and efficient workflow. And an example of pre-implementation costs include training costs. A first step in this process is identifying the key priorities and related relevant costs and assess areas of synergy and divergence. We believe it's important to collect cost data from multiple stakeholder perspectives to successfully plan, implement, sustain, and spread a program or practice. But often, some stakeholders' priorities and costs, such as frontline providers or individual recipients of the programs, are not included. We hypothesize that not including such costs will result in inferior long-term results and a lack of evidence-based program and practice sustainment. It's important not just to collect cost data from these stakeholders, but also to engage them using a participatory approach. Theoretically grounded research is critical to understanding key contextual implementation questions, such as what works, when, where, and why, and learn how to minimize both monetary and non-monetary costs and unintended consequences. It's also important to address conflicting economic priorities across stakeholder perspectives. Incorporating costs from various perspectives can be time and resource intensive. Micro-costing approaches, while likely the most accurate, can be challenging to execute in community settings where providers have competing demands and time is the most valued commodity. It may also require expertise in terms of assessing and comparing costs and uncertainties that not all community organizations may have. We also want to highlight the need for pragmatic approaches for costing implementation strategies because they involve costs at different levels, and researchers and practitioners increasingly recognize the need for more widespread application of economic evaluation. But as the field evolves, we need to remain cognizant of this practical application in healthcare and community settings to think about how we can apply principles of economic evaluation within implementation science to enhance evidence-based program and practice uptake, implementation, and sustainability. What pragmatic and practical approaches and tools do we need to strengthen the science and its applicability? Multidisciplinary and multi-stakeholder engagement is critical to this process.
So we wanted to mention some future directions for research in this area. Dr. Eisman and I are both contributing to a special issue on economic evaluation and implementation research. That's going to be coming out in the journal Implementation Science in 2021. Other things that we've been thinking about, lessons from the disciplines of decision analysis and behavioral economics. We're using a lot of approaches from health economics to date, but we know that there's findings from these fields about decision-making, heuristics, characteristics and biases that are going to be very relevant to implementation research. And we're starting to work on a paper in that area. I think there's a lot of application there, and there are people doing research in that area as well. Application of cost effectiveness analysis and implementation studies is still pretty rare. Dr. Eisman and I are both doing cost effectiveness analysis in studies that we've been involved with. We saw one study featured today by Garner and colleagues that included cost effectiveness analysis. So more of it is happening, although there's some important considerations when trying to translate methods that were really developed for patient level RCTs and adapting them for use in the types of study designs that are often used in implementation research. Finally, adaptive designs like sequential multiple assignment randomized trials. These designs provide a way to vary the kind of dose of implementation strategy that's delivered to individual sites based on looking at a response variable, and hold some potential for more cost-effective and cost-efficient implementation approaches. That's something that I think will be an emerging area in years to come. We mentioned a few of these resources and further reading in our slides. Encourage you to take a close look at some of these readings. Some of them are more foundational kind of texts, and some get into the applications of costing methods that we talked about. And then finally, we wanted to acknowledge some of the leaders of the special issue that I mentioned, Andy's team at the University of Michigan and Wayne State. I'm working with a group of co-authors on our cost of implementation strategy paper. I want to acknowledge them. We've both received funding from NIDA and NIAAA, and I'm a member of the Implementation Research Institute. So we wanted to thank you for taking time to listen to the presentation. Our contact information is here, and encourage you to reach out if this is an area of interest. And we're, I think, both happy to talk about issues in the field. It's something that we're both thinking about a lot these days. Thanks again.